of your weight in ounces of water every single day. Yeah, 60% of ounces, 60% of your weight in water every day is what I'd be striving for. I'm starting with the retatrutide tomorrow, and I'm also nervous. What would you say you are nervous about regarding the retatrutide? Retatrutide is pretty awesome. Retatrutide is the triple G, right? So with retatrutide, you're going to get the best results of retatrutide, no doubt. I would start with 1 gram a week. 1 gram per week is where I would start, and I would keep it at split that in half to 2 doses. So you can do retatrutide split in half. So in that case, a half milligram. And then, you know, the thing that I'm always stressing to everybody is we want to make sure that you're implementing the medications with proper lifestyle interventions. Like it's crucial. It's crucial that you're implementing fasting, low carb eating, and that you're lifting weights, heavy resistance training. Good morning, Darlene. Good morning, Dahlia. Welcome, welcome. Yeah, it's pretty amazing what the retatrutide can do. Yeah, retatrutide is pretty dope. One gram. Yeah, I would do 1 gram total per week. That's where I would start. Darlene, did you talk to your doctor about weaning off? I know a couple things you're taking that we discussed that you're going to work towards decreasing, which I think is a great idea, as long as you are slow and careful about it. Welcome everybody. If you just hopped into my live this morning, my name is Dr. Jones. I have clinics. We service across the nation, all 50 states. Specifically, we work towards helping people correctly use the GLP-1 meds. So when we talk about correct usage of GLP-1s, we have to consider how they're currently being used, which is really more, they're being used more in a way that kind of, it's like, here's your medication, you're going to lose some weight, there's no other option, here you go. Rather than thinking about obesity and weight loss struggles as this more complex issue that has multiple different pieces of it. And there's so many different areas of your health that we can pull on. And because we focus on looking at the big picture and incorporating all these other lifestyle interventions, we're able to move the needle. We are able to get really good results with our patients, which is freaking amazing. So do me a favor and introduce yourself. Let me know if this is your first time here. What's your name? Where are you watching from? How's your journey going so far? And by the way, this number right here, the 229 number, this is actually the best way to reach out to my team. So if you guys are curious, if you want to learn more, you know, what this is all about, all you got to do is shoot us a text message there. Hey, Tammy, that's super cool. Fit, we have different coaching packages. So there is one-on-one coaching, there's small group coaching, there's large group coaching, there's peptide GLP-1 only with no coaching. So, you know, of course, I think everybody needs coaching. That's always going to be my opinion. Everybody needs coaching, but you know, everybody's going to have their own opinions. Devin, I was able to achieve and break stalls doing the opposite of low carb. A high carb, low fat diet broke all the stalls for me and got me to do 20 pull-ups and 2 muscle ups, more energy on this diet. Devin, that's fantastic, my friend. Doesn't change anything for me. Number one, you're a one-off. I wouldn't say you're a one-off. I would say that, and I've always said this, if you're not insulin resistant, you could eat carbohydrates. Carbohydrates are always going to give you a more explosive form of energy when you're not really fat adapted. So if you're insulin sensitive and you're not fat adapted, you're going to feel better with carbs. So this is great, you know, fantastic. You're not insulin resistant. You were able to eat carbs and lose weight and feel good. Most people are insulin resistant. Most people are overweight. And therefore, when most people eat a high carb diet with low fat, they're going to get fatter. They're going to gain more weight. That's how that works. So, but you know, Buck, I watched your post about dinner only for 48 hours. Yeah. I mean, this is part and parcel with flow. We are slowly working people into the lifestyle of a longer round. So, the thing about doing it longer is you're gonna yeah, exactly, Devin. You're insulin sensitive, so you can tolerate carbs. Thank you, Darlene. I appreciate that. Yeah, the thing about doing the longer rounds of fasting is it's going to handle your insulin resistance. It's going to handle, it's going to help lower inflammation. And in lowering inflammation, lowering insulin resistance, this is the key to many people's success. I'm down 60 on a GLP-1 and I'm scared to gain it all back. Yeah, you know, you are right to be scared. This is a good idea to be concerned because the majority of people, and this is what nobody wants to ever say, so I'm going to say it, the majority of people are going to regain their weight. There, I said it. The majority of people who lost weight on GLP-1 meds are going to regain their weight. This is like it's like the elephant in the room that nobody wants to talk about. But this is the reality. And I think it has a lot to do with the fact that the way people are using these meds. They're not using them as a catalyst for change. They're not being encouraged to use them as a way and metric to allow and foster lifestyle changes. Because if you do that, you won't fall into the same vicious cycle. NEF, do you think this is also true for retatrutide? What are you referring to specifically? Do I think what is true for retatrutide? Can this program help with gut health and digestion? Yeah. Anytime you're doing deep fasting like this and making these kind of dietary changes, you're going to improve gut health. What are the best peptides for fat loss? In my opinion, it's always like the best thing is going to be stacking a GLP-1 like tirzepatide with AOD. AOD is your fat mobilizing peptide. And so you stack AOD with tirzepatide. Tirzepatide is going to suppress your appetite, improve your insulin resistance, reduce your inflammation, and AOD mobilizes your fat stores. So there's some really good synergy there. Kathy, why do it if you're going to gain? There we go. Kathy's asking the tough questions. Well, I mean, I don't disagree with you. I think that if you don't know how to use these peptides correctly in a way that actually sets you up for long-term success, I don't think you should use them. I think it's a sad reality for many people that they're being sold a pipe dream, putting these things on a loan, getting the medications, losing 20, 40, 50 pounds, and then sadly, majority of them gaining it back. It's some people though, it's not their fault. They're getting sold this stuff, the excitement, the allure, easy, rapid weight loss. And, they have no clue. They have no clue that what's in store for them if they don't do this correctly. But, that's what I do. That's why I go live every day. I'm here to help people, to the best of my ability, inspire, and hopefully prevent this stuff from happening. Yes, we still have tirzepatide. Yep, Delia, I 100% agree. Can you explain hyper responder? I assume I was because I lost 30 pounds on 2.5 of TERS. Yeah, I mean, hyper responder just is what we're referring to people who respond really well to lower doses. But that's great. That's great that you were able to stay on a lower dose and that you didn't need to continue to increase. That's fantastic. With the GLP-1s, they're usually 1 time per week. So usually you're injecting 1 time per week, but with the retatrutide might actually be better if you split it. What happens if somebody hits a plateau? So I think that's the other $1 million question, right? Like all the questions are being asked right now that need to be asked. What does happen if you hit a plateau? What are you going to do? Because most people don't have a solution. And most people are told, just increase your dose, just increase your dose. So you increase your dose when you're plateaued, and that could drive more weight loss. But you see how slippery that slope is because you're just essentially leading to more starvation. The number one reason why your weight loss stalls on a GLP-1 medication to begin with is because you're not eating enough food. You're not getting enough calories. You're not getting enough micro and macronutrients in the body. Yeah, I mean, it's an investment. You know, peptides are absolutely an investment. NEF, I'm splitting the Retta 1.5 every 3.5 days, 1.5 milligrams. Yeah, that's great. How much am I doing? I got an 8 milligram per ml. So I'm doing a little bit less. What am I doing? I think it's 1.25. Yeah. Currently, I'm on a low dose. I am on my pre-summer lean phase. April is when I decide to get ready for summer. So I'm doing a low dose of Retta and Semaglutide, a little bit of Teso, increase my fasting, and then throw in some AOD, add some more cardio, you know, those kind of things. I have not noticed increased strength, but I wouldn't be surprised because when you think about the mechanisms of what it's doing, the reduction in inflammation is beneficial towards your body's capacity to do anything. So that's not surprising. Yeah, intermittent fasting is like the best thing to do with your GLP-1s. I mean, without a doubt, pair your GLP-1s with fasting. That's how you supercharge your results, without a doubt. Because it's just, when you're fasting, you literally cannot, other than exercising during your fast, you can increase your fat loss by exercising during your fast. You can do that. I mean, it depends, right? I think if you were on a large dose of Tirzepatide and you came to my clinic, we would want them to work down, do a medication reset, work their dosing down to 0. That's one of the powerful strategies that we have. Intermittent fasting is where it's at. Levy, they don't follow up when they say. Maybe I missed part of that, but I'm not sure what you're referring to. Yeah, if you just hopped in to this live this morning, welcome everybody. My name is Dr. Jones. I have clinics. We service across the nation, all 50 states. I work with my medical practitioners. They prescribe GLP-1s. They prescribe the coaching or the Semaglutide, Tirzepatide, Retatrutide. We have the powerful fat loss peptides. We do the growth hormone peptides. We do the healing peptides. So there's a lot of cool strategies that we encourage. And then I do the coaching, which is nice because the combination of both, I think, is the only way that anyone is going to be successful long-term. You got to do both. Like if you're not doing both, I don't know what you're doing. You know what I mean? Like you got to have structure and there's a reason why I call it the 10 pillars of lasting weight loss, because there's just a lot to cover. Are labs or blood work needed? For GLP-1s, we always want to check your pancreas. So I think checking your pancreas is a good idea. Make sure that the pancreas is healthy. Pancreatitis is one of the downstream potential complications. And we're always trying to minimize complications, minimize side effects. But outside of that, we have comprehensive labs that we do. Oh, no. Yeah, I know. I heard in the UK that you guys don't have a lot of options, right? I believe that's what I heard. Does insurance pay for the comprehensive labs? Well, I only charge $149, Florida. Yeah, I don't like, to me, that's not bad for what you're getting. I can't get insurance companies to pay for these labs. It's $149. That's going to allow me to check your fasting insulin, C-peptide. It's going to allow me to check your CRP, your ESR. It's going to allow me to do a functional thyroid panel. So TSH, free T3, free T4, reverse T3, metabolic panel, A1C, like everything that we would want to look at, for this journey. How should I wind down off of the Retta? Say I have a total of 4 months supply. I just got done month 1. I don't know what the length of your supply has to do with winding down. Are you at your goal? Do you not need to lose any more weight? Like, what's going on? Hey, Aris. When is it recommended to switch from Terz to Retta? Never. If you're getting good results. If you're getting results on Tirzepatide, I wouldn't switch. Look, Retatrutide is something that I think makes more sense, has more use case for people that are coming from max dose Tirzepatide scenarios. Yeah, we do ship across the nation, all 50 states. Yeah, so that's what I was asking. When you say winding down, do you mean like taking a break, stopping together, or so I just wasn't sure what you meant. Good morning, guy. And depending on what dose you're on, you just kind of titrate down, decrease your dose till you get down to 0. No problem, NEF. I got you. Biggest transformation your program delivers. I mean, it's we've had people lose over 100 pounds. I mean, it's all across the board. The biggest thing that we do is just we take patients of all different starting points, morbidly obese, overweight, keeping them on lower doses, getting them to their goal. I think that's the magic. That's the goal everybody should have. And I think that's the goal everybody would have if they had more maybe appreciation or understanding for the difficulties of it. What up, Jason? Yeah, I noticed everybody was on this morning. When everybody's on, it's so funny, including Hacksmith, Kelly. Do you follow Kelly? Good afternoon, Ferdosa. So afternoon, you must be in a different country. I have no clue how many steps I do per day. I do not count. I just, if I'm going live, it's easier for me to use this treadmill. Oh, Jason, yeah, Kelly's some other GLP-1 creator who goes live a lot. Firefly down to 216 this morning. Feeling better than ever. Flow for life. Love it, love it. I'm stoked. I'm happy to see that you're getting really good results. That's awesome. Yeah, tesamorelin does target belly fat. That's what tesamorelin is specifically known for. The Wolverine Healing Peptide Cycle. Yeah, Wolverine's awesome. Wolverine is a combination of BPC TB500. It's the most potent peptide healing cycle when it comes to healing through these musculoskeletal injuries. Yeah, your visceral fat is just hanging out. It's just saying, hey. Yeah, visceral fat's the worst. Visceral fat is definitely, you got to get in front of the visceral fat. All right, guys, I'm going to hop off, get the day started here. But make sure